If you have no health insurance, but you need to see a doctor, I'm here to tell you that there is hope. I'm going to show you what to do specifically if you need medical care without insurance. Don't go anywhere. Welcome back, folks, to another section of the Awesome Sweetie Kiwi Show. How are you doing today? I hope you are doing fantastic. I'm doing marvelous, if you were to ask me. If you are doing as superb as I am, go grab a cup of coffee or tea or vodka and let's roll. In today's conversation, I'm going to show you what to do specifically if you need medical care without insurance. I have 5 sections that you want to really follow all the way through. First thing is, let's talk about how to find the right facility in a medical emergency. It is very important because medical costs vary depending on what type of facility you go to. So if you're paying out of pocket for your medical care, it is very, very, very important to know what constitutes emergency versus urgent versus primary care. This trifecta is critical. Emergency versus urgent versus primary care. You want to get appropriate care with an appropriate bill. Now, emergency rooms. Federal law requires all emergency rooms to provide care to patients who come in. This means they cannot turn you away if you are uninsured, but it does not mean that emergency room care is free. Emergency room care is the most expensive type, and you should only use it with absolute necessity. So if you're paying cash for your medical care, you would be a fool to use the emergency department for a minor medical problem. Consider going to an emergency room if you are faced with a medical event that poses a threat to a person's life or limb. Now, what if you don't have insurance but have a medical emergency? Well, as I just said, go to an ED. That's even if you or a loved one is uninsured. When possible, inform the staff that you are uninsured and inquire about lower cost options. What about urgent care? Now, urgent care facilities are useful for health issues that need to be addressed in a timely manner, but do not necessarily require emergency care. So if you can wait for several hours or more, but not long enough for a scheduled office visit with your primary care provider, then you should consider seeking urgent care. What about primary care? Now, when scheduling appointments with a primary care physician, it can take weeks or months to get you into the next opening, right? So during this time, you can call around and ask about options for uninsured patients. One thing I want to say here is that you have to think about community clinics also, because some health clinics receive federal funding and provide low cost or free health services. The most common medical services provided by these clinics include things like reproductive health care, for example, STD testing, contraceptives, and mental health care. So things like depression and anxiety. And you can go to a free clinic without insurance. No problem. Free clinics provide health services for little or no cost. And each clinic works differently to meet the medical needs of their community. So it's very important. Now, before I move on to the next element here, can a doctor refuse to treat a patient without insurance? In other words, can a hospital kick you out for no insurance? No, the answer is no. The Emergency Medical Treatment and Active Labor Act, EMTALA, ensures that all patients with or without insurance that are suffering from an emergency condition must be treated until their condition is stabilized. Having said that, if your condition is not an emergency and you are seeking treatment from a private doctor, very important here, private doctor, that doctor has the right to refuse treatment if you are unable to pay for the services. Let me repeat that. If your condition is not an emergency and you are seeking treatment from a private doctor, the doctor has the right to refuse treatment if you cannot pay for the services. So the conditions are pretty clear here. It has to be an emergency, and you have to go to a hospital or the emergency department of a hospital. If you go to a private doctor, he or she may refuse to treat you if you have no insurance. Let me now have a conversation with you about how to see a doctor without insurance. Now, first and foremost, folks, people should not avoid going to the doctor strictly because of cost. Your health is more important than the monetary value we have here. All right, it could cost your health and your wallet more down the line if you postpone getting the care you need. So even if you don't have health insurance, you can still see a doctor and receive medical treatment. And this is called preventive care. This could be acute care, urgent care, or emergency care. The difficult part is to find services that are affordable. That's the key word here, affordability. So the best places to start are community health clinics, walk-in clinics, and direct care providers. Let me break it down for you. So you have community health clinics. Those are likely available in your area. So this can be free or at low cost to you, right? And so those clinics provide some of the most necessary care for people, such as preventive screenings and vaccinations, without a hefty price tag of a direct primary care provider or insurance requirements. Then you have walk-in clinics, and those are also available for more routine issues, and they can take cash payments if you don't have insurance. You can see a doctor at a walk-in clinic for, say, minor issues and be billed for the visit. However, it's very important to remember that not all of this are affordable as others, so you want to make sure to ask whether costs are upfront. You have the direct care providers. So even if you don't have health insurance, it is still possible to see a healthcare provider. However, this may come at a fee. So there are clinics that cater to the uninsured, and those are known as cash-only clinics, concierge clinics, or direct care providers. So you may want to shop around to find a doctor that you like, who also fits within your budget. Then you have the hospital emergency room, and that I've already talked about it. If you have an immediate medical emergency, you should always go to the hospital emergency room, or you have to call 911. Emergency medical providers like hospitals generally cannot refuse care in a medical emergency because you don't have health insurance. So but having said that, you gotta know, you have to let the staff know that you are uninsured, as you may be able to arrange repayment terms over time with their billing department or get assistance applying for emergency, Medicaid, or other insurance. And then you have the urgent care centers, and those are available for immediate emergencies and other time-sensitive medical needs. And usually they are often able to take direct payment from their patients. And they may, this actually could be a cheaper alternative to a hospital visit, provided that the clinic is able to address your medical needs. And this urgent care centers are like a walk-in clinic for more serious concerns, such as broken bones, sprains, and wounds requiring stitches. I'll be right back right after this. Don't go anywhere. Welcome back, folks, to another section of the Awesome Suite Kiwi Show. We're also having a conversation today about the if you have no health insurance but you need to see a doctor, what is the right strategy to actually to use? So I want to talk to you now about how much does it cost to see a doctor without insurance, because this is the goal here. You have to be aware of the cost element here. Without health insurance, the average doctor appointments costs somewhere between $300 to $800, depending on where you live. I want you to remember, though, that the range rather, will vary depending on the services and treatment you need, as well as the type of doctor's office. And there are things you can do, and I'm going to share those tips with you later on. You can use some strategies to minimize your medical cost, even without insurance, to ensure you don't break the bank trying to stay healthy. Unfortunately, if you are uninsured, getting medical care can be quite costly, especially in the United States. And just how costly is difficult to determine because, again, it depends on the medical issue you're having, the type of provider you are seeing, and where ultimately you live, right? The average cost for diagnostic test, according to research, can also vary quite a bit depending on the region and where you went. So, according to the Healthcare Blue Book, and this is a database, a very well-known database that compiles rates, a blood count lab test can range anywhere between $15 to $100. A chest X-ray can range between $40 to $250, and a fetal ultrasound can set you back between $89 to $480, $500. So as you can really see, the thing here is that we're having a real challenge to estimate how much medical care might cost if you end up needing it. So just how much you will actually end up paying depends on where you are receiving care. I've given you different categories of care centers before, from community health clinics to walk-in clinics to direct care providers to hospital emergency rooms to urgent care centers. So it really depends on where you end up receiving the care. Some clinics can give you discounts or allow you to pay on a sliding scale that is based on your income. Community clinics may end up being cheaper than going to a direct care provider, and urgent care clinics can be less expensive than a trip to the ER. So it really depends on your specific health problem and where you go for treatment. One thing that's very important is that prior to going to a clinic, please, you want to shop around to compare prices or find out if you can get the treatment you need somewhere cheaper. How do you save money when you don't have health insurance? So when getting medical care insurance, when getting medical care without insurance, there are a few things you can do. There are a few steps you can take to minimize cost. And I'm going to give you, I have 10. We have 10 tips that are very important. They have proven effective at helping thousands, if not hundreds of thousands of patients in the United States minimize their medical cost. Number one, you want to mention that you are uninsured. That way you can find out if there are any discounts that you may be eligible for. Number two, you want to shop around for care that fits your budget. Very important, because rates vary by location, so you want to look for a free or sliding scale clinic. Ask if a facility has a sliding scale to help lower income patients. So sliding scales help match your medical bills to your income level. You want to ask for a payment plan, because some healthcare providers will let you pay over time to reduce upfront costs. You want to double check your bills, because guess what? Errors are common. So make sure you are being charged the right amount. Medical coding errors are surprisingly common, and it is always worth double checking your bills. Number 5, negotiate your bills. You can even negotiate bills after you receive them. You just want to call and ask. So negotiating medical bills before or after the visit can help make medical expenses more manageable. Don't be shy. It's all about your money. Number 6, use prescription savings cards like Single Care, for example, to reduce the cost of any prescriptions you need. We have an entire show focused on prescriptions discount cards. But Single Care is a good one. Number 7, ask for drug samples or a generic version, because this can greatly reduce the out-of-pocket price for medication. Number 8, you want to check to see if you are eligible for Medicaid, because it's based on income, right? And it's based on income, household size, and where you live, among other factors. So you might qualify for Medicaid. Number 9, you want to apply for financial assistance. So if you are having a medical issue, you're not a bad person. If you're having, if you're just having a situation here and you need some intervention, there are myriad places where you can ask for financial assistance. For example, you have hospitals that do offer financial assistance. You also can reach out to a charity. You can reach out to a state organization, a state agency. There are a lot of opportunities out there when it comes to seeking financial assistance for medical coverage. And number 10, you can also ask for charity care options, or if they have discounts for patients paying cash. So according to the Wall Street Journal, paying with cash can reduce the cost by as much as 90%. I'm actually showing you right now on the screen. There is an article that came out in the Wall Street Journal a few years ago, And the article was titled, How to Cut Your Healthcare Bill, Pay Cash. Hospitals and other providers increasingly are offering cash prices far below what they charge through insurance. So this is, you can see on the screen here, this is the screenshot of the article. I really want you to encourage you to go and read that article. It's fantastic. Now let's talk about how to lower your health insurance cost in general. One thing that's very important is that when we talk about healthcare, we all agree that there are things you can control and there are things you cannot. You cannot control when you get sick or injured, but you do have some control on how much you pay. Very important. So there are a few things you can do. First, see if you are eligible for government subsidies. So if you buy your own health insurance, for instance, you may get help paying for it from a government assistance program. So you have something called the Advanced Premium Tax Credit. It's a credit subsidy that lowers your monthly premium payment. You have the Cost Sharing Reductions Program that lowers the cost share amount you pay for medical care. Both of these programs are designed to help people with limited incomes. So you can use the healthcare.gov tool to see if you are eligible for a lower cost. Also, you want to see if you are eligible for Medicaid. So every state has a Medicaid program and Children's Health Insurance Plan, CHIP, to provide health coverage to low-income individuals and families. So you want to contact your state Department of Insurance or health department to learn more about these programs and if you are eligible to enroll. You also want to see if you are eligible for Medicare. Before it was Medicaid, now we have Medicare. So you may be eligible for Medicare if you are age 65 or older, even if you're still working, doesn't matter, or are any age and disabled. And the standard monthly premium for Medicare Part B medical insurance is $144.60 for 2020. In 2021, it will go around $150. And most people who have worked at least 10 years and paid Medicare taxes do not pay a Part A hospital insurance premium. And you also want to choose a high deductible plan that pairs a health savings account, an HSA. So if you are not eligible, let's say for a government assistance program, you may save money with this insurance plan type. So the premium is very low for high deductible plans, and many plans pay for some preventive care. And the HSAs are savings account that you use to pay for medical expenses not paid by your insurance. So what you do is you save on taxes with an HSA because the money you put in and take out is either tax-free or tax deductible. Very, very important. All right, folks. Those are the 5 things I wanted to talk to you about. But before I close this chapter, I close this story, this show here. Please remember, and this is a pro tip: you want to start a rainy day fund now, or you want to apply for a medical credit card. So if you're faced with a situation where you are just realizing you have no health insurance, but you need to see a doctor, having those 2 options, either or both, can be an excellent choice. So what's a rainy day fund? This is also called an emergency fund. So you want to put some cash aside. You want to save some money for situations like this where you have no insurance and you just got to see a doctor, right? So basically trying to have experts are telling you to have 6 months worth of expenses in a saving in a rainy day cash account. I'll say go to 12 months or 18 months. That's option number 1. Number 2, you want to apply and see if you can pre-qualify for a medical credit card. So it could be Medicare or Wells Fargo medical credit card. You want to have that just in case. And much like store credit cards can be used at the retailers whose branding they bear, medical credit cards can only be used for medical expenses and only certain kinds at that. So they are generally expenses that are not covered by Medicaid or Medicare or are only partially covered by private insurance. And some examples of care that is not covered or that is covered by a medical credit card include things like cosmetic surgery, right? For example, and the medical credit cards include Care Credit, Access One Med Card, Wells Fargo Health Advantage Card, and iCare Financial. All right, folks, this is it for today. I just want to quickly recap today's conversation. So I was just talking to you about if you have no health insurance and you need to see a doctor, there are a few things you need to have in mind. So how to find the right facility in an emergency. How do you see a doctor without insurance? I explained that to you. How much does it cost to see a doctor without insurance? How to save money when you don't have health insurance? And how to lower your health insurance cost in the future, now and in the future. And I just sort of mentioned the health savings account, the HSAs. Thank you so much for your attention. I really appreciate it. I hope you are doing fantastic. And until next time, stay healthy and marvelous.